1. Introduction, Anatomy, and Clinical Relevance. The document establishes that anatomy is the science of the structure and function of the body. It specifically focuses on clinical anatomy, which is defined as the study of the macroscopic structure and function of the body as it relates to the practice of medicine and other health sciences. This emphasizes the practical application of anatomical knowledge in healthcare settings. The anatomic position, a foundation for description. The core concept is that all anatomical descriptions are based on a standardized reference point. The assumption that the person is standing erect, with the upper limbs by the sides and the face and palms of the hands directed forward. This is the so-called anatomic position. This standardization is critical for clear and consistent communication in anatomy. 3. Planes of reference. Visualizing the body. The lecture introduces 3 key imaginary planes used to divide and describe the body. Median sagittal plane. A vertical plane passing through the center of the body, dividing it into equal right and left halves. It clarifies that planes parallel to the median plane are termed paramedian. Coronal planes, imaginary vertical planes at right angles to the median plane. Horizontal or transverse planes, at right angles to both the median and the coronal planes. 4th positional terms. Describing relationships. A core theme of the document is the vocabulary for describing the relative positions of body parts. It covers medial and lateral, a structure situated nearer to the median plane of the body than another is said to be medial to the other. Similarly, a structure that lies farther away from the median plane than another is said to be lateral to the other. Anterior and posterior indicate the front and back of the body, respectively. Specific terms are introduced for hands and feet. Palmar, anterior hand surface. Dorsal, posterior hand surface. Plantar, lower surface of the foot. Dorsal, upper surface of the foot. Proximal and distal. Describe the relative distances from the roots of the limbs. For example, the arm is proximal to the forearm, and the hand is distal to the forearm. Superficial and deep. Denote the distances of structures from the surface of the body. Superior and inferior. Indicate levels relatively high or low with reference to the upper and lower ends of the body. Internal and external. Describe the relative distance of a structure from the center of an organ or cavity, e.g., internal and external carotid arteries. Ipsilateral and contralateral. The term ipsilateral refers to the same side of the body. Contralateral refers to opposite sides of the body. Supine and prone. The supine position of the body is lying on the back. The prone position is lying face downward. 5. Movement. Terminology. Describing joint actions. The document explains the terminology for describing movements at joints. Joint definition. A site where 2 or more bones come together is known as a joint. The level of movement in joints vary from immovable, skull sutures, to freely movable, shoulder joints. Flexion and extension. Flexion is a movement that takes place in a sagittal plane. Extension means straightening the joint. Note: flexion is usually an anterior movement, but can be posterior, as in the knee joint. Lateral flexion. A movement of the trunk in the coronal plane. Abduction and adduction. Abduction is a movement of a limb away from the midline of the body in the coronal plane. Adduction is a movement of a limb toward the body in the coronal plane. Abduction and adduction also refer to the spreading and drawing together of fingers and toes. Rotation. The term applied to the movement of a part of the body around its long axis. Medial rotation. The movement that results in the anterior surface of the part facing medially. Lateral rotation. the movement that results in the anterior surface of the part facing laterally. Circumduction, the combination in sequence of the movements of flexion, extension, abduction, and adduction. Inversion and eversion. Inversion is the movement of the foot so that the sole faces in a medial direction. Eversion is the opposite movement of the foot so that the sole faces in a lateral direction. Protraction and retraction. Protraction is to move forward. Retraction is to move backward, used to describe the forward and backward movement of the jaw at the temporomandibular joints.